a system. It's not just a thing or an event, but it's the whole process. And that's what we got to look at as far as is some of it on our end as well.
If health is a state of mental, physical, spiritual, and social well-being, a state in which the body is functioning at 100% and not merely the absence of disease, then why is it that black people are the least healthy race on the planet?
Welcome to Black Health by Evoke, a podcast where we discuss the unfair access to care, health inequality, and the cultural and generational impact of poor health in our communities.
It's time for us to take responsibility for our own health. Meet Dr. E, Dr. T, and myself, Dr. V. We want black people to be encouraged and empowered, for our people are perishing for lack of knowledge. It's time for black health to thrive, not just survive.
What's up, fellas?
What's going on, fellas?
What's going on, y'all? Man, I'm loving that hat, dude.
Man, you know, I think I might wear this every show, every single
You
show.
should, man.
Yeah.
You should.
Man, I think that it would be something that would be grandiose.
I got this
Did you have it made?
I did not.
Or-
I actually got it at a conference. You know what the interesting thing is that it's one of the cool chiropractic conferences that we go to just by happenstance. I know you got our listeners won't be listening to it on the day, but Dr. Vault is actually speaking at the conference where I got this hat this upcoming weekend. So you guys can there'll be
I might be able to purchase me one.
There'll be some swag for y'all to purchase. Yeah, be some.
Absolutely. Hey, you know what, you all fellas, you all know the actual origin of the baseball cap,
Right.
Or the beanie.
A Scully, huh?
Beanie.
You all know the origin though. Do you all know the
Not at
origin of
all.
the baseball cap?
Oh,
No,
what,
I
man?
just
Come
wanted to know
on!
if
I
y'all
thought
knew.
you was about to give us some. I thought you was about to tell us a story about how, like,
You know,
it came from
no,
the Sahara, from Africa to keep the sun out of their eyes when they was. Yeah, I thought you was going to tell us an interesting story, man. Nothing.
It came from.
Man,
It came
I'm
from
sorry,
farmers
listeners.
playing
I'm sorry,
baseball.
listeners. We try to get
That's where
y'all
it came from.
I
information.
thought somebody was came along and completed the sun visor.
Right. You know what I'm saying? It was like, why do we cover the whole head?
Right.
Thanks for that, Dr. Ball. We appreciate it. Appreciate the knowledge. Man,
No problem.
on a more serious note, we were
Food for
doing
thought.
again researching and talking about some of the things that we think are important for us to address on Black Health by Evoke, and without a doubt, one of the most important things for us to address are the health inequalities that we encounter as Black people in our system, in a healthcare system that is not necessarily structured and designed for us. And with it not necessarily being structured and designed for us, we have to plug ourselves in and fit ourselves into that system. And when you have to plug yourself and fit yourself into a system, there's not typically a natural place for you, right? So the people within that system don't always handle you purposefully or without purpose. They mishandle you when you're in that system. And that's what we find way too often when it comes to African Americans in today's, American United States a healthcare system.
I think a lot when you bringing this topic up. When I look at the system, man, there's a lot of things that you can say about it, and I'll say that the one thing that I've noticed since I've been in practice as a chiropractor and listening, I think the best way to really understand it, you have to listen to the people.
Yeah.
The people and the stories that they have. And, it just seems like this system wasn't really set from the beginning. It really wasn't set to take care of our population.
Yeah. And I think that's the main thing is it wasn't designed for us. Right. And, and that actually, be given, how the origin of our country and stuff like that, it makes sense. It makes sense that it wasn't designed for us because we weren't allowed to participate in it. Because what we saw was as hospitals in this country were being built, Black people, were getting their health care at home, right? We were getting our health care on the farm. We were getting treated there. The doctor would come in because we weren't allowed in the clinics and we weren't allowed in the hospitals. We weren't allowed in the healthcare facilities. And that's something that, really stuck with us for years, for decades and, about a century or so before we were ever able to participate in that. So much so that we had to begin to build our own infrastructure.
Yeah.
And being a victim of a failed healthcare system, it's funny that today that you're really bringing up old story for me. When I was 16 years old and I went to a hospital with terrible pain in my stomach, and I had been to 3 other specialists. I had 3 different diagnoses, and one of the things that happened was the last doctor told me I had appendicitis. And I laid down, I had that surgery, and I flatlined on the table. And what anesthesiologist made an error in putting anesthesia in, and I woke up with a tube in every orifice of my body, and come to find out nothing was ever wrong with my appendix. I had gas. And around the city of Detroit, a lot of these mistakes were happening, but they were happening at hospitals in the cities. Wrong knees getting surgeries put on. Having surgery put on wrong limbs, or things getting transplanted that shouldn't have been. And it's been an issue, and it's still an issue.
I think another thing you have to take into consideration as well, you bringing up the fact of, being in the inner city and things like that. Historically, when you look at it as well, when it comes to hospitals and insurance, a number of, when you consider the Black population, when you consider those in the inner city and those that may be living in more rural areas, the health insurance coverage that, that they posed or that they had, really didn't pay much to hospitals. So if you're going to a hospital for a particular issue or something like that, they're going to do the probably the minimalist amount of work, or run the most minimal amount of tests, just so just because of the type of coverage that you have.
Yeah.
So this conversation can really go pretty deep, man, because when you're talking about health disparities, what are some of the causes of that? And I think definitely healthcare coverage, we would have to factor that in.
Yeah, because you're right, man. And y'all both hit on the two things that I think are really important, is that, Black people are being failed in an already failed system, right?
Mm-hmm.
So all of Americans are being failed in this system, but African Americans are being failed as a people within that system, right? So we getting a double time in this system, because we always talk about, the way, the traditional Western healthcare system works, and how it's just not working, right? And how it's mistreating the human frame and the way the body was meant to work. It's taking the wrong angle, right? And then when you put Black people into that system that's already taking the wrong angle, and the people that are taking care of those Black people when they come in, are not thinking of them the same way as they may be thinking of other people when they come in for care, then you're getting the worst of bad care. Instead of just bad care, you're getting the worst of bad care, and we see those outcomes, man. And I was looking at these numbers, and the numbers are startling when you think about mortality rates. And this is us talking about the healthcare system. When we look at it, for maternal mortality rate, meaning women who are pregnant or having babies, for white women, the number is about 13 per 100,000. That means 13 people are dying per 100,000, which is already a crazy number. That's already a lot, right? That's already a lot. But you know what it is for African American women? 41. That's more than 3,000 per 100,000.
Wow.
You would think with all of the technology that we have, all of the different resources that we have, we shouldn't have a climbing rate.
Well, so the question
of
to
mortality,
be posed is: we know anatomically
of
and, and
immortality.
from a physiological standpoint, there is a very, very, very tiny piece of DNA that separates a white woman's body from a black woman's body. They are virtually the same, right? They are virtually identical in the way that they function and the way that they work. They are identical. So if they are identical, then why is it that the mortality rate is more than 3 times? And the only conclusion that you can come up with is the only thing that separates the two. One's black and one's white. And so that must point to the type of care and the type of attention and the way they address issues within the healthcare system.
Definitely. So basically, there you have two people that come in. The only thing that separates them is color, is what you're saying, right?
Exactly. That's physiologically the truth.
Okay. So then, basically, it comes down to, again, the services that are being performed, or just the care that's taken from one person to the next.
Right.
It's kind of it's heartbreaking when we talk about things like this, because in this country, there's such a fight with racism. When you talk about racism and you talk about race being a factor, and it's blatant sometimes, you can see it. But the argument on the other side is that, well, there is no racism. There's not this.
That bad.
It's not because of this. It's not because of color. It's not, it's not any of these things. But how else can you explain any of that?
Right.
Well, you got to look at the whole process. It doesn't start just in the room where the baby's being birthed. It's the prenatal care. It's the access to information. It's the care throughout the whole process. So when you talk about a system, it's not just a thing or an event, but it's the whole process. And that's what we got to look at, as far as is some of it on our end as well. Because now we need to do the research and we need to have the knowledge on the process, so that we can have the proper demands that when we go in, to make sure we get the quality of care that we need to have in order for this to change.
Yeah, I mean, and that's easy to say, man, but I've heard all too many times, man. We've been in the healthcare field for a long time, and when you have, we have practice members that come in, and some of the stories that I've been told from them about certain things that they had going on. Doc, I had to go to the emergency room, or I had to go see my doctor. And they tell you stories like, and they didn't even want to do this, or they didn't want to see me for this. And they literally are telling me that they're arguing back and forth with a nurse or with a doctor, because they won't give them what it is that they need. I'll give you a prime example, something that just happened recently. With sports in session. And this is just now with like the urgent cares and things of that nature. Oof. But there were two young black boys that went to an urgent care to get physicals so that they could play high school sports. They went into the urgent care. They got the nurse got their height, weight, all these different things. And when the doctor came in, he asked them one question, and that was, have you had the vaccination, COVID vaccination? Because they were not vaccinated, he refused to give them a physical to play sports.
That's so crazy.
So that I mean,
she was the son on the
team. That doesn't matter. It's like, with COVID, people have the option of getting the vaccination or not.
Especially when you're talking about teenagers.
And these are teenagers,
especially
at that. So, this is a white doctor, and you got two young black boys. Why would you? What's the reason for not giving them a physical? What's the rationale?
Right. It's
none at all.
right, and it's because of the way he felt. Right, there's no scientific or medical reason for him to not give them a physical. It's just how he felt about COVID and how he felt about the vaccination, and then applying that to to two boys that he probably don't have any kind of relational personal attachment to, because we know culturally that's where those attachments happen, right? And so they treat it just like a number, or they treat it as not meaning much. And so he making a decision based on that, and that's the insane part about it, is when black people say the system, that's what we mean, right?
That's what we're talking about.
To be really, really clear about this is that we are not running around saying that all white people are racist. What we are saying is that a system has been put together that's racist, that we are all now participating in. That's whether you black or white, we are all participating in a system that has been structured and founded on racism. That's what we're on, discrimination, on segregation, and that's what we're saying. So if you are a white person in this country, we're not calling you a racist unless you are one. We're not calling you one. What we're saying is that we are all participating in this system that discriminates against a certain sector of the population, and those are the things that need to change, right? We're not trying to change you. We're trying to change the structure of this country that puts us in a position where 3.5 times as many pregnant black women die as white women. We just want the same care. We want the same quality of care. We want the same attention. We want the same empathy, right?
And then I don't even know if it's possible. I know you all know the story. We can look at Prince. We can look at Michael Jackson. We can look at Serena Williams. Went to the hospital. She almost died. She asked for some care.
That's true.
That she wasn't given. She knew what she needed. She was very aware. She's a billionaire. She's the top percentage. And she's one of the greatest, if not the, she is the greatest woman to ever hold a tennis racket. But she went to the hospital and told them what she needed and fought for it. And she fought for it. And because she had to fight for it, knowing what she needed, and she got it. How many of us don't go to the hospital, and don't know what we need?
I hear what you're saying.
100% unaware of how to fight for ourselves. So is the system, even if you're a billionaire and you're at the top and you're still not, your opinions and your knowledge of your own health is not being valued when you're communicating it in a way, and she's highly intelligent. What do you do?
The thing. I get what you're saying, Dr. Vaught, like you said earlier about educating ourselves, because right now does matter, right? Ideally, how we would love for things to be is really, really important, but the right now does matter. And being black within a system, you have to educate yourself before you walk into a doctor's office, before you walk into a hospital, before you walk into an urgent care. Before you walk into your chiropractor, you have to educate yourself before you step into the system, because it's a system that you just can't trust is going to be looking out for your best interest. And just the way it's set up and the way it currently functions. So I hear what you're saying, Dr. Vaught, that we as African Americans have to arm ourselves with the right information before we step into the system.
Yeah.
Right. Not on Instagram.
And I think the other thing is there's been a lot of lost trust when it comes to the black race and that system that we're talking about. Because we know, we've been taught you have issues, you go to the doctor, you go to the emergency room, but because we are becoming aware of all these different, all these problems, all these issues, the disparities and things of that nature when it comes to our healthcare system. And I think it has put a lot of fear in a lot of people that where, you have an issue going on, your high blood pressure is running up, you feel like you're having a heart attack, but some people are afraid to even go to the hospital because, if I go there, they're going to kill me.
Right. Which is, it's unfortunate, but it's a legitimate concern. The infant mortality rate amongst African Americans is 11 per 100,000, and for our white counterparts, it's 4.7. So more than double, right? There's more than double of a chance that your baby won't survive within the healthcare system if you're black. Again, a black baby and a white baby are physiologically identical. They're physiologically identical, so it must be the system. There must be something going on that's causing these numbers to not be exactly the same. Because if we're being truthful about it, those numbers should be identical, right? They should be exactly the same. But the problem that we have is that they're not. And because they're not, it's important that we have these conversations about why they're not, right? And if they're physiologically the same, it's only a few things that you can point to. Some of that is our responsibility, but most of it is the system.
Yeah.
I think the first step, as far as is really making some change, is having the conversation. I think we've all been too well been taught. I mean, and when we don't talk to that uncle over there. We just don't say nothing about him. Everything is hush hush. When something is wrong, or when something is out of pocket, it's always hush hush. And so because we keep things quiet, things are allowed to happen, and not allowing things to have a certain amount of visibility. I remember, Dr. Everett, you were telling me about a hospital in St. Louis. I mean, I don't know which, because I mean, what was the name of it again?
I'm one of these people, like when I begin to look at something, like I get a little fanatical about learning about it for just a short amount of time, but I get a little fanatical about learning about it. And as we were all doing this research to talk about these health inequities. One of the things I came across was Homer G. Phillips. And it is a historical hospital, or was a historical hospital here in St. Louis. And something that, myself and Dr. Tipley have heard about from our older practice members, time and time again. And they speak about it from a position of pride. And my assumption, my incorrect assumption, was that Homer G. Phillips was just another hospital, right? It was the hospital that Black people went to. That's basically what I thought it was. And that is what it was. It was the hospital that Black people went to because of segregation. We were forced to build our own hospital, and not because we were not allowed to participate in the healthcare system, but we needed a hospital. And so they built Homer G. Phillips. The problem is that Homer G. Phillips became this amazing, renowned hospital in the country. Like the care was exemplary. People were getting amazing results. The nurses were some of the best in the country. The surgeons were some of the best in the country. The triage care was top 10 in the entire United States of all hospitals. So what happened to Homer G. Phillips is it became an amazing hospital, which, from what I understand, was not what was expected, right? It was just supposed to be a place, because the other thing to remember is that healthcare actually used to be a social service, right? It used to be healthcare. Hospitals used to just be available to everybody. Your doctor used to just be available to everybody. And it becoming a business is something that is more recent, right? So it was built, with government funds, because we had to have a hospital for Black people. And when it became so, and when we saw this shift from healthcare being a social service to healthcare becoming a business, now the system started to say, shoot, all our customers are going to Homer G. Phillips. We don't like that. We need our customers over here. We didn't want y'all before when it was just about us taking care of you, but now that y'all customers, we need y'all over here to increase our revenue. And so Homer G. Phillips, was under attack because it was doing really well, right? It's expanding, and they add these programs, and all this innovation is happening because Black people went there exclusively. And because Black people went there exclusively, now they're getting their health insurance from the factory that they work at, or the job that they work at, or the school that they work at, and they sending all that money to Homer G. Phillips, and this hospital's flourishing, and the system just did not appreciate that, so it was under attack, and as it became under attack, the pressure got so much, and the leadership in St. Louis changed, and they started to basically defund, Homer G. Phillips. And as Homer G. Phillips got defunded, obviously the quality of care went down. Right, the system couldn't, it can't sustain without the funding, without the money, and it eventually closed. Right, there was I believe it was 20 days. Don't quote me on that, but I believe it was like a 20-day strike. Right, it was a 20-day protest for Homer G. Phillips closing. Black people did not want Homer G. Phillips to close, but it did. And the new mayor, we got a new mayor, and then we got new leadership, and that new leadership decided to close it. And today it stands as a senior living facility. It was converted into a senior living facility.
Yeah.
After Black people fought for it to not be torn down. So they wanted to erase basically Homer G. Phillips from St. Louis history. And right now it's a senior facility, bearing the same name. But the fight is remarkable, man. So a lot of times this points to one of the issues that we have is that we ask the question, and I know I'm talking a lot, fellas. I'm almost done, but we ask the question, why aren't Black people doing as well as other people? And the real answer to that, in my opinion, is that we've been trying. We've been trying, and the system is fighting against us. Like, we've been trying. Like, we had this amazing hospital that was doing well, that was giving high quality care to African Americans, and the system did not appreciate it. We see that in so many different areas all the time, and that's certainly something that we see in healthcare. There's a documentary about Homer G. Phillips that I would encourage you all to see. That's remarkable, and it details out this story that I just talked about, because it's just a prime example of what we experience in this country, and and what we're all working so hard to change.
Yeah.
So the big shift, and even with you, Dr. Tipline, I know just I've been home with you, to your hometown, in Southern Illinois.
Right. Get
No,
it right
Southern
before he jump
Missouri.
through the screen on you now.
Right. You see, I was waiting until you finished to correct you, but you corrected yourself. So you did right, young man.
He don't play them games. He don't play them games about the boot hill.
Okay, I was trying to make it fancy, but I'm just gonna say the
There
boot
you
hill
go.
of Missouri.
There you
There you go. And me being from Detroit, Michigan, my own experience with the failure of the medical system for me, and me wanting to see people of color or people like myself really have access to doctors, access to information, really lit a path and evoking me to be a chiropractor. And you having the same experiences, another region of the country, another different type of a more rural area in the country, and so that means if we really just spread it out and really lay the groundwork, it's like that everywhere. It doesn't matter. Serena Williams being a billionaire, it doesn't matter. So my question to you, Dr. Tipline, and Dr. Everett really brought a point up, because I know Dr. Tipline, you're a methodical thinker, and really looking at that. What's the solution, or is there a solution? Because when a system is designed, it's designed with what they call fail proof.
Fail safe, yeah.
Right? So if something comes up, it fail safes. Mm-hmm. Something knocks it down. If a thought is had, and I pose this for both of you, because but I know that just I see your wheels turning. What do you think the solution is? I mean, because I think one thing is prayer. I mean, we got a God that can do anything. But I mean, what our listeners really want to know, okay, so we're just in this position where we're just going to get shafted and there's nothing we can do?
There's a lot that can be done. It's already been proven in history. Mm-hmm. So, when you talk about a solution, Dr. Everett just talked about a hospital that took care of a hospital that was ran by blacks, black doctors, black nursing staff. And by the way, that says a lot for the type of care that people received. Because if you go to the doctor and you're able to talk with a doctor that looks like you, then you have a relationship. There's a different type of bond. There's a different type of trust that's created. So what he talked about with Homer G. Phillips, that hospital in particular, was that you had a community that trusted this particular hospital that was, it was in the system, but the system decided to get rid of it because we had something bigger and better that we needed to transfer this money to. So I think the solutions have always been there. When you look at, look at some of the other things historically, with the Black Wall Streets in different cities, developing banking systems, all these different things that have already been done by blacks, but we have a larger system that's always have a fail-safe or some type of a plot or plan to make sure that it doesn't thrive. So I think for us as black people is really understanding what has been done in history. We may not be able to get back to those certain levels, but if we have that mindset and have the same thought processes, then it gives us the power, because now we know how we can fight. We know the correct things to say. We know what we can demand. We just have a little more power when we really understand these things. Because I think it's like I was saying earlier, there's a lot of information that we gather, but if we don't understand how to use this information to our advantage, then we'll be stuck in the same place.
Right. Because there is some personal responsibility involved in all of this, right?
Definitely.
The system does exist. But like Dr. Vaught was talking about earlier, we still have to talk about the right now. We can talk about the ideal world that we would all love to live in and that we're striving for and that we're working hard to get to. But we also have to survive right now. You're living right now. And the answer right now is to arm yourself with the information that you need in order to successfully navigate this system that we're currently under. That's really what it is you have to understand your health. You have to understand how the body works. You have to understand what questions you need to ask. You have to understand what foods you need to eat, what exercises you need to do, how you need to take care of yourself mentally, what's going on when you have eczema, what's going on when you have stomach pain, what's going on when you got blurred. We got to understand these things. And we are fortunate that the access to information is not one of our issues these days. Right. The access to information. Now, we still lack a lot of that knowledge and a lot of that information because we haven't gone out and looked for it ourselves. But the lack of information is not an issue. The lack of information being available is not an issue that we currently have.
Something I tell my patients when I get started with them, that it's a 50-50 relationship here. Right. I'm going to do my part and they got to do theirs. And then I sit them down and I say, you're the best doctor you're ever going to know. No one understands your body the way you do, experiences pain and discomfort the way you do, or has the power to make the changes the way you do once you understand what's going on with your body. A doctor has a degree that says he read a certain amount of books and he has access to information that you may not be able to get. But once you are imbue or empower yourself, so something that, just popped in my head as well as far as being a solution is really people being responsible and something similar to what you just said, Dr. Everett, for their own health. The doctor shouldn't have to tell you, oh, your blood pressure is high. You may need to exercise. You may need to exercise because you need to exercise, period. The doctor shouldn't have to tell you, oh, you're dehydrated. Your sugars are high. I mean, if you're eating a balanced diet, and if you don't know what one is, Google. You ain't ask no more. Google. As a matter of fact, Alexa, what's a balanced diet? I mean, you don't even got to get up to find out. And listeners, I'm not. I mean, it's not that simple, but it is. But I mean, the minute that we empower ourselves with being responsible for ourselves, this shell that we're living in right now was a gift. but we treat it like it's a prison. But it's actually a beautiful, beautiful place that we have the opportunity to have some amazing experiences in. But when we don't take it as the gift that it is and give it what it needs, it's not going to thrive. And we should never, ever make sure that an institution that has a system is 100% responsible for the vitality of our future.
We weren't designed. The system wasn't designed to be leaned on. It's just not. It's not set up that way for anyone, right? Of any race, of any color. The system is not designed to be leaned on, right? And that's not just the medical system, healthcare. Period. You know what I mean? Your physical therapist, your mental health professional, your orthopedic surgeon, or your chiropractor. The system is not meant to be leaned on. When you go into your chiropractor, the answer is not just fix me, right? You didn't go there to just for that chiropractor to fix you. That's because that's not the way it works. You know, you with your chiropractor for 15 to 20 minutes, you with yourself 100% of the time, right? So who can more effectively change the state of your health? You know, and so you can't, 99% of the time make bad choices and expect for that 1% of the time to fix it all. It's not the way your body. It's not the way the body works. It's not the way health works. It's not the way life works.
That's some powerful stuff, fellas.
Yeah, man. I think and I hope you guys out there listening can tell or watching can see how passionate we are about this subject matter, because we're doing this and talking about these things because we understand how important it is and what kind of impact it will have on our culture and our society if Black people were to get healthy.
And being a chiropractor and being someone that's educating people about their health and watching the miracles that happen and unfold right in front of our faces, and looking at just the children growing up and being healthier and understanding their body and not having a lot of the systemic issues. I mean, during the COVID pandemics, during all of these things, our offices were full of people that weren't dealing with a lot of these problems based upon them being educated about what it is. And it's so frustrating sometimes as a practitioner or a doctor when we can really be the solution to a huge problem within our community.
I think we're our own solution.
Yeah. Yep. The reason that the medical profession calls chiropractors crazy is because our system is designed to get solutions. And the ideas behind solutions are foreign in the medical profession, right? The solutions take time. Solutions take effort. And that's just what it is when you're looking for a solution. So when the medical community hears us say, you need to see your chiropractor for the rest of your life, we crazy, right? We quacks. But they don't have any problem telling you need to take high blood pressure medication for the rest of your life. I have no problem with that. You know what I'm saying? So it's a different way that you have to begin to look at your health in order to get to, the solutions.
Definitely.
And some people, if you don't do what it takes, you will have to take high blood pressure medication for the rest of your life. You just gonna have to do it, and that's if that's your choice, if that's your decision, right. That's fine. That's fine, but you have a choice.
So, man, dude, it's always a pleasure. This is always fun, right? And it always makes me think when we get on and we talk about these topics. Hopefully, it's making our people think when they hear what we're talking about, and it's beginning to shift and change their paradigm in the way that they see, how the world works in relation to their health. So as always, fellas, I appreciate y'all.
Good conversation, fellas. Appreciate you guys.
Yeah.
Hey, keep pushing. Keep pushing.
What they need to do, Dr. Ball.
Changes within there. Hey, what I would love for them to do is definitely love themselves, love their family members and friends, and a way to show them that they love them will be sharing this podcast so they can know how much we love and appreciate them and want for them to
No
experience
better way to say it.
good health.
Thank you for listening to Black Health by Evoke.
He who has health has hope, and he who has hope has everything.
You can find us at www.evokingblackhealth.com or all social media platforms at Evoking Black Health.